Hello, can everybody hear me? Good evening, ladies and gentlemen.
Good evening, ma. I hear you.
Good evening. So can we start? Randy, can we start? Or we should wait for more people?
No, fire down, though. If I want to, go sell it. No, join.
Chairman, sir. Good evening, sir.
Good evening, ma. You can't join.
You said?
No, you can start. They will join. More people will join. It's just start.
Okay. All right. Good evening, ladies and gentlemen. Dr. Progress is not here yet, but I will start. So we're talking about fertility preservation today. All right. It's going to be very interactive, so that's why I didn't prepare any slides, so that everybody can ask as much question as they want to ask. So we're going to be talking about fertility preservation. Who needs fertility preservation? Why is it important? Why is fertility preservation now being talked about more often these days? Now, we all know that, especially those of us that are ladies like me that live in Abuja, I know that getting Mr. Right or even getting Mr. Left to come to Mr. Right has become a serious issue. And time is actually now going, or people who are dealing with health challenges like cancer and people who want to actually enjoy their lifestyle, enjoy their life before they think of having kids. Now, that's where fertility preservation comes in. You don't have to be sick before you think of preserving your fertility, or you don't have to be like 40 before you think of preserving your fertility. No, you can preserve your fertility even now, maybe because, okay, you just feel like you've not really enjoyed your life enough. Let me freeze my eggs and go and enjoy my life. Or you just feel like, okay, let me freeze my sperm because I don't know what tomorrow holds. Especially if you are using substance as a man and as a woman, substance abuse can cause depletion in sperm count and quality of egg, and even fragmentation. Even though your sperm count doesn't reduce, it's going to cause a lot of DNA fragmentations. And for men, the older you get, the more fragmented your sperm becomes. So that's why it's very, very important. Now, we are really advocating that everybody, whether you're married and you're not married, it's very, very important to freeze your gametes. Personally, even me, before I even meet KK, I have my eggs frozen in Gariki Hospital. Maybe because you say, oh, you work there and you are aware of this. That's why you did that. Yes, I was working in Gariki and I'm aware of fertility preservation. Yes, that was why I did that, because I didn't even know if I was going to get married anytime soon. So I was just wanted to freeze my egg so that in future, even though I've entered 45 or I've hit menopause, before I will not meet the right person, then I will know that I can actually now have kids with my own eggs and not depending on donor eggs. Because truth be told, for a woman, the older you get, the more you are getting close to menopause, and the number of eggs, the quantity of eggs you have is reducing. So it's advisable, or it's advised, that you should freeze your eggs to enable you have your own biological children much later in future. Or women who have history of genetic, family history of breast cancer, cervical cancer, or any form of cancer, so that before you go for chemo, you know that you have eggs frozen to have your own child. So it's very important. Now, for the men, you are not just saying, I be guy now, anytime. My grandfather had children at 70, at 80. But how intelligent are those kids that your grandfather had at that age? Because the older you get as a man, the less intelligent children you tend to produce. Every 90 days, your body is generating new sperm cells, And the older you get, the more fragmented those sperm cells become, the less intelligent children you tend to have. So it's very important that, oh, as a guy, just walk into any fertility clinic. You don't even need to open a folder. I want to freeze my sperm. Simple. They will just simply freeze the sperm for you. You will just pay a token and your sperm will be frozen. Simple. So now you said, because I don't have health issue. You don't have any health issue. What about your job? What about those of us who consume a lot of alcohol, who smoke? Because these things have ways of affecting your sperm cell. Maybe you are exposed to severe heat, or you have business going to the south a lot. Because of, but as a matter of fact, 90% of our IVF cases in Nigeria in the south are male factor infertility. Why? Gas flaring, soot, all those harsh environments in the south have reduced the sperm count of most of the men there drastically. So if you have any business with any job that's going to be, that will prove to have an issue for you later in future, it's better you preserve your fertility. Or I'm 30 years old as a guy, I've not really made it, Nigeria never favor me. It's better you freeze your sperm now, so that by the time you now hit the amount of money you are looking for before you get married, you know that you are still going to have very intelligent kids. It's not that you are now 50 years or 60 years, you've now made it, you now want to start giving birth to children at 55 or at 50. And you expect the kids you are going to have to be as intelligent as the one you should have had when you were 30. There's going to be a lot of difference. So we advise everybody, freeze your sperm as men. As ladies, freeze your eggs. If you even, as a lady, you have the plan of, oh, I don't want to get married, I just want to be a single mother, but I don't want to do it now. Since you already have that plan, you can freeze embryos. Come to the hospital. I want to have a baby, and I want my baby to be a half caste. I want the sperm donor to come from Jamaica, from Iraq, from anywhere, just name it. There's always sperm there to treat those eggs, and we freeze the embryos, so that by the time you are done with enjoying yourself around the whole world, even you come back at the age of 45, at the age of 50, and you want to achieve pregnancy, it's going to be easy. All we just need to do, bring out these eggs from where we kept them and implant them. That is just it. Now, what does it take to freeze eggs? Because you have to go through some eggs so that you can produce more than one egg at a time. Because if you want to freeze your egg for a lifestyle reason, lifestyle means you are not ready to get married now. You have visa to the US, to Jamaica, to Australia, to everywhere. So you want to tour the world, and when you are 40, you'll be ready. You will just take some hormonals. There's some hormonal injections that you'll be giving. Now, when you take those injections every day for like 10 to 14 days, it will help you produce enough eggs. The process of retrieving your egg is not painful. It's seamless. In 10 minutes, we are done, and you are going back home. It's not expensive, it's not painful, it's easy. Now, but for the men, you don't need all those injections. No, just an ejaculate. You can choose to masturbate, you can choose to have sex with your partner. If you don't have a partner, you have sex dummies in most of the IVF centers in Abuja here. They will give you sex dummy, you have your sex, you give us semen, and we'll freeze. Once you already have your gametes frozen, your sperm, your eggs, or embryo, or even tissues, because we have some men who, they have sperm issue, and eventually they have to do a pincer, put some needle through the penis and the testicles, and to get the sperm, and we freeze those. Even when you are 7, very important. I'm sure most of you that are here who already married and have children, please, you can help pass the message across to people who don't and who are willing to preserve their fertility. Thank you very much. Open to your questions as many questions as you want to ask. Dr. Heskey, are you asking me this question? What is the definition of infertility? What is the pathophysiology of the infertility? What is the percentage spread between men and women who has more prevalence? Okay, now infertility is the inability to achieve pregnancy after unprotected sexual intercourse for at least or at most 12 months. Okay. Now that is how you define infertility. You should have been having regular sexual intercourse. It's not that you have sex on Monday, then your next sex is going to be in 2 weeks' time. No, that is not that is not a couple that is infertile. Infertility is when you are having at least 3 times, you're having sex at least 3 times in a week. At least 3 times in a week, except when the woman is on her period. The sex has to be regular and unprotected. Okay, now we have different causes of infertility. We have the male factor, we have the female factor, we have the tubal factor, and we have the unexplained infertility. Unfortunately, the unexplained infertility has gotten up to 34% recently. Why? You see a young woman, 32 years, husband, 37 years, sperm count good, hormonals good, both tubes are patent, the both tubes are open rather, patent. So when the both tubes, the 2 fallopian tubes like this, they are both open, so sperm cells can actually pass through. She's ovulating, her eggs are good, everything is good, but pregnancy is not just occurring. That is unexplained infertility. And now this has become so common. Some people will say, what's that? Now, when we talk about male factor infertility, we're talking about sperm. Now, you have a lot of causes of male factor infertility. You have men who have poor sperm motility, poor morphology. Some of them even have very poor count, or some of them don't even have sperm at all. Then we also have people who have ejaculatory dysfunction. They can have sex for 1 year straight and they have not ejaculated. We have people who have retrograde ejaculate. They can have intercourse and they have the urge that they are ejaculating. They have come during the sex, but the ejaculate doesn't come out. It goes straight back into the bladder. Now the man has to go and urinate for the sperm cells to come out. So how does the wife get pregnant? He cannot urinate into her vagina. So automatically that patient becomes a fertility patient, because we have to get the sperm cells out of the urine for us to treat this, for us to help the woman achieve pregnancy. Now, for the female infertility, when we have female factor infertility, we're talking about a tubal blockage or poor ovarian failure. We have women who are 20-something getting into menopause, 28, they are in menopause. Meanwhile, some people are there, 46. They are still producing very good eggs. So these are just, it varies. It's not like, it's not common to one person. Okay. Please, how much does it cost for male to freeze their sperm, and which center can do that in Abuja? All right, sperm freezing in Abuja ranges from 200,000 to 300,000 a year. Okay. All the IVF centers in Abuja freeze sperm. All IVF centers in Abuja, Nissan, Dida, Harmony, all IVF centers freeze sperm. There is no one that does not freeze sperm. Every one of them we all do sperm freezing. So you just walk into the clinic first, they will do your semen analysis to be sure that your sperm is even freezable. There are some sperm that are not freezable. There are some men that once you freeze their sperm, the moment you are thawing the sperm, thaw means you are waking the sperm up, all the sperm cells are dead. There are some men who ejaculate. Immediately they ejaculate, 2 minutes later, all the sperm cells are dead. Those sperms are not freezable sperm. Ejaculate with sperm cells less than 10 million are not freezable, or less than 5 million rather, are not freezable, because the number of sperm cells that will survive will not be much. Okay. Now, Randy asking, I hope say them go share condom. You don't caution. No, not the share condom. I want to freeze my sperm. They go live 200 to 300,000. You mentioned gas flaring as one of the main causes of infertility. Does cooking gas stroke men entering the kitchen involved? No, it doesn't. Cooking gas doesn't contribute. Now, I don't know how many of you have lived in Port Harcourt or have family that live in Port Harcourt or Warri or Ukeli or Bayelsa. If you look at the window sill, every morning or even every time you go to their house, on the window sill, you see everywhere is dark, like like this, like as if tire is burning. It's always stained black. That is soot. Now this soot is coming from gas flaring. It's not this our normal cooking gas. No. If you have family, friends, or men that live, people that work in fertility clinic in the south, they will tell you that most of the cause of infertility in the south are male factor, because this soot is not just reducing the count, it's also fragmenting the sperm cells. You are going to ask how now, but the body produces the sperm cell every 90 days. Yes, every 90 days, whether you have sex, you don't have sex, the sperm you have in your body will die off, a new one will come alive. Now, because of this soot, you are inhaling, you are eating, everything you're drinking water, you don't know that these particles of those soot have entered into the water or in the food you are eating. You are ingesting them unknowingly. Now, that's already, it's a killer, okay? It causes a lot of damage. Genetically, it destroys the sperm. The sperm begins to break in fragments. Instead of the DNA fragment of the sperm to be straight, you will see it will either have a lot of gain or a lot of losses. It will be divided. Okay, so this is what actually normal cooking gas, no, it's not an issue. But if your husband is a welder or he's exposed to severe heat, it becomes an issue. Or he's a dispatch rider. You understand? And he's sitting on, if you are a dispatcher and you are driving your car, that normal. But as you are sitting on the tank that has for heat, that's why we tell men, if you are home, feel free. You don't even have to wear, I call this short knicker for play, something that will allow air come into, that will allow the testicles breathe. The temperature there is not supposed to even get up to 37, 38. It's too much. So let's just be at normal body temperature. Okay. So I can see another question here. At what age does fertility actually begin to decline for men and for women? All right, thank you, Doshima. Now, fertility decline varies. It all depends on your genetic makeup. Now, both of us might be of the same age, but we don't have the same ovarian reserve. Okay, if at 35, my ovarian reserve is still like, I do my AMH, and my AMH is 7.5. There's another lady who will be 35, and her AMH will be 2.2. So we differ, but once you are 35 years, we advise, and you have been having sexual intercourse, unprotected sexual intercourse regularly for 1 year, that's 12 months, unprotected sexual intercourse for 1 year, and you're already 35 and you've not been able to achieve pregnancy, please find the nearest fertility clinic. Someone said long distance driving can affect men's fertility. I don't know how true it is, because Mr. Chairman, sitting for a long time and maybe the guy is putting on a tight short or something, as far as the testicles is generating heat, it should be killing the sperm cells there. But mind you, as I said, spermatogenesis is every 90 days. So just like our reverend fathers who don't have sex, so every 90 days, the sperm cell, will be generated again by the body. So long distance drive, except the man is supposed to put on boxers, put on trousers, then body generating heat. Okay, you mentioned cooking, coming back at 40 or 45 to retrieve eggs. Well, no. If you didn't have the idea Okay, sorry, let me read that your question again. You are asking if a 40 years woman or a 45 years woman, it's not a high risk pregnancy at all. As long as you don't have any health challenge, at 40, people are still giving birth. As long as you don't have any health challenge, your uterus is good, your endometrium is fine, you are fit. Getting pregnant and achieving pregnancy at 40, 45 is not an issue at all, at all. Achieving pregnancy at that age is not an issue at all. Now, or you mentioned coming back at 42 to retrieve eggs. Now, if because you didn't get the information early, you are not aware of fertility preservation and you got to know about it at 40, and at that 40, you don't have anybody on your right or on your left, freeze your eggs. Because at 40, if you have good AMH, you are still going to get enough eggs to freeze. So that by the time you eventually get somebody on the left or on the right, you can actually now come back, use your own egg to have your own biological children. It's not high risk at all. If you are worried that, oh, maybe these eggs or the sperm might have genetic issues, you can take the next step of doing a pre-genetic testing before you have the embryos transferred. Okay? Okay, women above 35. Can you speak more about women above 35? Now, I don't know what you want me to explain, but for women above 35, if you are having unprotected regular intercourse, unprotected regular, not regular, it's not like you're having sex in January, you have sex out of 31 days in January, you have sex only 10 days. That is not regular intercourse. You are not fasting from sex. As far as you are not fasting from sex, we'll advise you when you come to the clinic, we'll advise you have intercourse 3 to 4 times a week, at least 3 times. Okay, 3 to 4 times a week. It's okay. When you have 3 to 4 times a week and you don't achieve pregnancy after 1 year, then you should see a fertility specialist. Now, if you notice that, oh, maybe there is an issue somewhere, or if at 35, you have been having intercourse from, let's say, from 20, and you have never one day, you've been having unprotected sex from 20 years, and now you're 35, and you have never for one day missed your period once, then I think you should see a doctor early, because there might be some issues you don't know about. All right. What is the cost implication for pre-genetic testing? It's between 5 million to 6 million. It depends on the hospital you are using for your testing. How does PCOS, endometriosis, and fibroid affect a woman's fertility? It affects a lot. Now, for PCOS patients, you don't even know when you are ovulating. PCOS patients, you come about with so many eggs, but those eggs, most of them are not matured. The risk of having hyperovarian ovarian syndrome is there when you have to treat for any fertility related treatment. Now, PCOS messes with your body a lot because your period is not regular. When you ovulate, you don't even know. Okay, so in some cases, when you have patients who are PCOS patients, we have them being managed so that
Oji, we're not hearing you clearly. Check up.
the opportunity to achieve pregnancy if we are not doing IVF. Okay, but the best treatment
Okay, sorry for the breaking transmission. Let's just give her a few minutes and see if the network she gets back. Okay, thank you so much. Okay, so please keep dropping your questions so that once she comes on, we'll read them to her, that she can answer them as once she comes on. Okay, can keep dropping your questions. Thank you very much.
Can you hear me now, Dr. Chika? Can you hear me?
Yes,
Hello?
I can hear you now, but we can't see your video.
Hello? Can you hear me?
We can hear you here. Good. We can see you now. Can hear you.
All right. All right. So we're talking about PCOS, endometriosis, and fibroid. Now, fibroid can affect fertility depending on the location of the fibroid. It's not all fibroids that affect fertility. There are some fibroids that are not in the uterus or on the endometrial lining that you can actually achieve pregnancy with. It's not once they say you have fibroid, automatically means it's going to affect your fertility. No, depends on the location. As far as where it's going to, where the baby is supposed to stay, then you are good. And also the size of the fibroid. If the fibroid is very tiny, anything 1 point something, 2 point something, it's not a problem. Okay. So it depends on the location of the fibroid and the size of the fibroid. If the fibroid is not big uterus, then it's not a problem at all. But for endometriosis, it has to be treated before you think of achieving pregnancy. Now, when endometriosis is treated, the chances of achieving pregnancy at home is high, is there. Okay. Now, I missed some of the questions because I logged out. So please, can I get the next question? What is the remedy taken for 40 to 51 days of no period?
Yeah.
40 to 51 days, no period. How old is the patient? How old is the woman in question? Okay. Depend on your age. A woman that has not seen her period for 40, what is the remedy taken for 40 to 51 days of no period? Depend on your age. How old are you? Are you, is this a sign of menopause? You know, there are some women before they get into menopause, their period starts season. So it depends on how old the woman is. If she's already menopausal, so you are sure that okay, that's why she's not seeing her period. Please, what's the next question? Because I can't see any question here anymore.
Okay, I will read them to you. I'll read them to you. So after that remedy taken for cases, the next one was that the nature of some people's jobs can cause infertility. Can I have an idea of what these jobs could be?
Okay. Now for the men, okay, let me start with women. Any job that is extremely stressful, we all know that stress alters the hormones for most women. Now, anything that causes stress can affect our hormones and thereby causing hormonal imbalance. Okay, so anything you are doing as a woman that's going to be a lot of stress, it's a lot stressful, it's going to actually affect your fertility because you need good rest so that your body can, relax to achieve pregnancy. Okay, now for men, any job that is high risk, expose you to a lot of heat, it's going to cause infertility. Now, also, you're talking about lifestyle also. One of the major causes of infertility is lifestyle. People who are substance abusers have a high risk of becoming infertile. Sperm DNA fragmentation, oocyte quality will drastically drop. Now, and most times, even though they achieve pregnancy, you will see high risks of miscarriage every day now and then. All right, Dr. Chika, please, next question.
Okay, somebody asked, considering the high cost of procedures like sperm and egg freezing in Nigeria, how can fertility preservation be more accessible to an average income Nigerian?
Okay, funny enough, fertility preservation is actually cheap. It's actually cheap, and 200,000 a year, I think, is actually very cheap and very fair. If you walk into any of those fertility clinics, some of them will even allow you to pay every 6 months. Now, if you are not preserving your fertility because of the cost, I don't know any other way apart from living healthy and making sure you don't die on time or you don't get into any accident that will cost you your organs.
Is it usually covered by insurance, any form of insurance?
No, 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 no. Insurance doesn't cover any form of fertility treatment in Nigeria because those insurance companies don't pay well. Now, there's only one insurance company that pays for fertility treatment, which is Asamasa, but you have to be on the platinum package. NHIS, no.
Okay.
Next
Now, what
question.
kinds of food and activities are recommended for good sperm health?
Okay, very good. Now, food rich in grains, granite, what they call it, corn, maize, grains, and nuts. Actually, cashew nuts and groundnut is very good for sperm production and sperm quality. Okay, then lot of proteins. Now, you can do exercise is very good for both male and female. For women, achieving pregnancy, when you are very good with keeping fit, it sends enough blood flow to the uterus. You are achieving pregnancy as fast as you can. Now, for the men, any exercise that is not strenuous, just live a healthy life. Then eat healthy. But nuts and grains are very good for sperm.
So one question
Right.
said, having intercourse regularly in terms of the man leaving the sperm inside all the time, right? As in, that's she was trying to like ask based on the other question.
Mm.
Like, does it mean having intercourse regularly? Does it mean that the man should leave the sperm inside at all times? Like, right?
Does it mean that the man should ejaculate into the woman? Yes.
Yeah.
When you have intercourse, the aim of having intercourse is for reproduction, right? So when the man has sex, he should ejaculate inside the vagina so that the sperm cells can swim straight to the uterus. If you are having intercourse and he's ejaculating outside the vagina, then that is not intercourse, that is just play. So the sperm cells have to be there at all times. All right.
Somebody asked, what food is good for egg preservation?
What food is good for egg?
Yes, it's good for egg preservation for the
Is
woman.
she asking what food is good for egg? Because there's difference between egg preservation and quality of eggs. Because you are not preserving the eggs when the eggs is with you.
I think it's the quality of the eggs that she's talking about, maybe, probably.
Okay, fine. Now, food rich in protein and a lot of fibers. Now, for women, we actually advise them to take a lot of food rich in vitamin C and even a lot of supplement, actually. L-arginine, vitamin E, vitamin D. All these are if you have food rich in vitamin E, vitamin D, vitamin C, please, and fish is very good. Omega-3, if you know you cannot sustain it, going to market to buy fish to eat, or eating orange every day, or going under the sun, or looking, just do yourself the favor, get all those supplements and just be taking them daily. It helps a lot.
Okay. Next question. Say, how long should one try to conceive naturally before considering other assisted forms of reproduction?
Okay, for women under the age of 35, 12 months of unprotected regular intercourse. 12 months of unprotected regular intercourse. Once you are above 35, after 6 months of unprotected regular intercourse, please seek help. All fertility treatment does not have to end with IVF.
Please help us define what regular sexual intercourse really means.
Regular sexual intercourse means having sex with your partner at least 3 times a week. At least 3 times a week. That is regular sexual intercourse. It's not that you have sex on Monday, then no sex again till next week Monday. No. The reason why you are having sex.
It's not ovulation. It's not ovulation sex.
No, it's not ovulation sex. Regular intercourse. You have sex on Monday. Then maybe because you are not in the mood on Tuesday, you have sex on Wednesday. Because you're not in the mood on Thursday, you have sex. The reason why you are having sex at least 3 times a week is because sperm cells survive outside. Good sperm. Now let me put it. Good sperm cells survive after an ejaculate for at least 72 hours. Okay. So now when you have sex at least alternate days, the man has ejaculated on Monday, even though he's not around to have sex on Tuesday. If the woman, by God's grace, now ovulates on Wednesday, there is sperm cell already waiting for the egg. Do you understand? But you are having sex on Monday, you are not having sex again till next week because ovulation does not follow the way most people calculate it. You know, some people say, my period started on 1st of January, so on the 14th of January is my ovulation. You will fail. Because sometimes it doesn't work that way. Ovulation can take place either day 10, 11, 12, 13, 14, to day 16. Any of those days, it can happen. So if maybe there is already seminal fluid or sperm cells waiting already in the uterus, it's easy. So regular sexual intercourse, at least 3 times a week. If you have the strength to go 5 times a week, enjoy yourself. Next question, Chika.
Take note of that. Enjoy yourself, okay? Okay. At what point in life should an individual realistically begin thinking about fertility preservation as a preventive measure rather than a crisis response?
That question again.
Say, what point in life is an individual realistically supposed to be thinking about fertility preservation as preventive measure rather than crisis response?
Oh, wow.
You should expect that, okay, like now you're
Yes.
preaching now that we should save our eggs for the future, like
Yes.
this preventive response. At what point in time is this person supposed to be doing this? At what age?
If you're already 35 and you don't seem to be seeing anybody that looks serious, okay, as a lady, I think it's okay. Now let me use myself as for example. At least Chido knows my whole story before me and Keke, all those drama. Now, I have 21 of my eggs frozen in Gariki Hospital. In 2018, I just like, all the boys in Abuja, they are just breaking my heart. This one will collect my money and run. This one will collect my motor, run. I can't say, before I don't know when I'm going to see the one that has sense, so let me just freeze my eggs. And I froze. Now, I already have 2 kids. Maybe later, people planning on maybe dashing the eggs or using it for research purpose. Do you understand? I froze those eggs just in case I don't near 40. I never see anybody. I'll just go and collect my eggs, collect Caucasian sperm. I've already made up my mind. I'm going to get sperm, Irish sperm, fertilize, give birth to 2 very fine children, half caste. They asked me, I would say the man don't die for sheep. That was my plan. Do you understand? So now, once you are 35 as a lady and nobody seems to be coming, all you need to do is first go and freeze the eggs. Or if you suspect, now that a lot of people are coming down with breast cancer, as in I can tell you, most women don't even know they are prone to cancer. Now that once you notice that there is a lump somewhere, before you hear that it's cancerous, just go and freeze your egg and keep. Or if you find out that in your family, your mom had lumps in the breast, your auntie had the same, this person had, there's a pattern already. You don't have to wait till you hit that age when the thing comes up before you freeze. No. Now for the men, you are trying to make money. And the only solution, or somebody has told the guy, you push drugs. Before you start pushing that drugs, freeze your sperm, because cocaine is one major killer for sperm cells. I don't know if I've answered that question, Dr. Chika.
We'll get to know from the person that asked. If you've trashed it, the person will respond. Okay. The next question, like, what are the myths and misconceptions surrounding infertility? The myths and the common ones.
Okay.
Surrounding infertility.
Some people will say that this infertility thing is one way of hospital eating our money. It's not true. Or children born from IVF are not intelligent. That is not true. Okay. Or anytime you come to IVF center, they will always use donor egg. That is not true. It's not true. People already have that notion that the children that they give birth to through fertility treatment are not intelligent, or they will end up telling you to use donor eggs. That is not true. Okay. There are 1,001 of them, but this is what I can remember for now. Next question, please.
I think as you remember them, maybe you can just throw it out. Anytime you remember anyone, you can just throw it out. Okay. So somebody asked them, let's say after freezing your eggs, before you could even use it, you die. What will happen to the frozen eggs?
Oh God. Okay, now when you come for egg freezing, we have consent forms that we give to patients when they come for fertility preservation, whether egg freezing or sperm freezing. Now there's a place there that has that clause. In case of death or in future you do not need, think if those sites can be used for research purposes, and they'll give it out for research. That is what happens. If you consent for it to be used for research, but if you don't consent and you die, and they try reaching you after 1 year, so as a matter of fact, if a patient freezes their gametes, sperm or egg, any one, or embryos, they pay for the first year. The second year, you don't hear from them. The third year, you give them 3 years grace. When you don't reach them after 3 years, you have the right to either discard or use it for research purpose, but you can't use it for treatment for another person. Next question.
Thank you very much. Somebody asks, why is fertility preservation often framed as a woman's issue? And how can men be more informed and proactive about their own reproductive health? When you talk about infertility, mostly
next question, Dr.
everybody looks, when you talk about infertility, mostly everybody looks at the woman, men issue. How can we involve men more in these reproductive health issues and all that? Okay.
Okay. Please repeat that, because I think I lost you somewhere.
I said, the person asked that why is fertility preservation often framed as a woman's issue? How can men be more involved? How can men be more informed and proactive about their own reproductive health?
Well, the truth is because of the environment we live in. Now, people have been made to believe that once a couple is not having a child, automatically it's the woman's fault. But funny enough, these days, we even see more of the men coming into the hospital to come and find out what is the problem. Why am I not having a baby? Do you understand? Now, because of their ego, most men don't want to reduce themselves to coming to give you their sperm cell or give you their ejaculate. They just feel humiliated that you give them a container and say, sir, please put your semen here. They feel insulted, they feel humiliated, but they don't know it's for their own good. But these days, most men are coming to the realization that, yes, it can be my fault. So they are forthcoming these days now. And they could come and take it to me with quick. So they are coming to the realization these days now.
Okay. Now, somebody asked that, can we list the supplements that you can use to enhance fertility? Maybe on the WhatsApp group, so we can Maybe
Okay,
list
so
it later.
okay.
Or you can mention a few here and then we'll list it later on WhatsApp.
All right, vitamin E is very good for both men and women. Okay, 400 milligram. Please don't take 1,000 milligram. 1,000 milligram is too much for a woman trying to conceive. For the man, yes, you can, but 400 milligram is adequate. Vitamin E, omega-3, vitamin D. Okay, now vitamin E and vitamin D is good for both man and woman. I'm going to list. I'm going to drop on the WhatsApp group the one that women need and for what reason. Much later.
Okay, so the next question. In a quest for women without children to have kids, they run into cryptocurrency scam. I don't understand this one. Can you enlighten us a bit? Please. Who asked this question? Do you have any words for this person? Hello, OG.
You say they run into cryptic pregnancy. Is it what you said?
No, is it? I'm saying cryptocurrency scam. Or is that cryptic pregnancy or cryptocurrency? Please, Dr. Eze, is this cryptic? I think it's cryptic pregnancy. Maybe he's trying to talk about.
Yes, you said
I think
what?
it's cryptic pregnancy. He's trying to talk about. That in a quest for women without children to have kids.
Question, but
In a quest for women without children to have kids, they run into cryptic pregnancy scam. I guess so. That's what he's trying to say.
So a lot of yes, a lot of people have had issues with all these cryptic pregnancies. Most women who have infertility issue, I can give you a baby. I can give you a baby without even finding out how the babies are even being gotten. Now, what they do to those women is they just pump them with a lot of progesterone. They give a lot of progesterone. You are not seeing your period, your stomach is that is pregnant. That doesn't want the baby. They will tell you those so they come, you will deliver your baby. If you do the scan anywhere, they will not see the baby. All those things are just, there's a baby there, but you are not seeing it. With that. And you will even go, to deliver and you are, but yeah, now what they are doing is baby factory. Somebody, maybe a nurse. As a matter of fact, let me give you a true life story. In this Abuja, a woman had she had gone to one place in Marab and she was like, I am 8 months pregnant. They said I should not do scan. Pregnancy test, we did test negative. 1 week later, she came back that she don't born. For the same woman, she came to the woman that gave birth through CS in your did not find the body. Was the black, this what they call them birth mark, this whole place, like like vertigo. The woman's husband white like this. And there they asked, for follow-up and one or two because they didn't want to go to Nyanya with mark like this, white general hospital. And giving to this, so that is hypnotized. I don't know what they do to those people, whether they hypnotize them or pregnant. So cryptic pregnancy is just baby factory.
Okay, yeah. I think sometimes most of those women actually know what is, as in, they know what is going on, you know. I think they have an idea of what it is, because you won't allow anybody to keep pumping hormones into you now if you don't know what is going on, except the woman is trying to cover up as in, maybe somebody is trying to find out and is trying to take her to the hospital and she's trying to cover up and all. Most of the time they know actually what is going on. Maybe they have been promised a baby from a baby factory and they just have to use all those hormones to cover up, you know, until the time that they pretend that they are going to give birth at one place like this and come back with the baby. So most of the time they actually know what is going on. It's not like they are blind towards it. So it's a multitude of a web of lie that keeps accumulating until the baby is so-called, the baby is born. So that's what I think. So it's not like they're not aware. Most of them are actually aware. So that's that. Now, somebody asked the question, are there side effects for a man who has sex daily?
Yes.
A man who has sex daily, is there any side effects?
Oh, no.
Oh, there's no side effect to it.
Okay. Okay, good. Then the next question is, how will
There's any side
couples
effect
who
for that
okay, your OG, check your
Sorry?
network, you're breaking.
Hello,
You're
Dr. Chika.
breaking. I'm losing you in many places.
Dr. Chika, you're actually cracking. I can barely hear you though.
Yeah, okay. Okay. Can you hear me now?
I hear you very well. I think it's her own
Okay.
network.
MTN network is messing.
Okay.
She can hear you very well. I think it's her own network.
Okay.
Yes.
Okay, so the next question. How will
I
couples
think it's MTN network.
yeah. How will couples who live in different locations cope, considering that they might not be able to have sex regularly at least 3 times a week for a year? Is there a way they can plan using the ovulation period?
Hello.
Can you hear me?
Yes, I can hear you. I can hear you
Okay.
now, Chika.
Okay,
I can hear
so
you
as
now.
they said, how will couples living in different locations, how would they cope? As in with this regular sexual intercourse of 3 times a week, you know? Is there a way they can, is there a way they can plan using the ovulation period? Is there a way they can plan using
now
ovulation period?
I'm an example of that, okay? Because I live in Abuja, my husband lives in Kano. Truthfully, it's not easy. But if you are a couple that you don't have any child yet, one person has to make the sacrifice, especially if you have stayed for 1 year already and there's no baby yet. Somebody has to make a huge sacrifice. Someone has to make a huge sacrifice for that. It's either you are taking 1 monthly without pay, or the other partner is taking 1 month. You have to make a huge sacrifice. Now, if you cannot sacrifice that, because yes, we all know that getting a job in Nigeria is becoming difficult, the man can freeze his sperm while the woman plans for an IUI. Okay, that is just the only solution. That is just the only solution, actually. To achieve pregnancy, somebody has to make a sacrifice, or if nobody is ready to risk their job, then the man has to freeze his sperm for the wife to achieve pregnancy with IUI. I don't know if that answers
Please explain what is IUI so that the laymen can understand.
Insemination. Now, how IUI is intrauterine insemination. It is, we help plan your wife's ovulation. Already the man has given us his sperm, the seminal fluid. Then we have the sperm cells in them already. We give her a series of injections and oral medication. Then we watch her ovaries or her follicles, we watch them grow. Now, the follicle is what houses the egg. You know, like boiled groundnut, that boiled groundnut we used to buy 1 cup, 200 naira. You know, it's when you open the groundnut like this, you see, when you open the pod, you see the groundnut inside, right? So now the follicle is the pod in the ovary. that is housing the egg. Now, because her husband is in Kano and she's in Abuja, once she starts her period, the second day of her period, we start giving her injection so that those follicles, those pods, will start growing bigger and bigger and bigger until they are very big. When they are very big, we give an injection we call trigger. It's HCG. Now, this injection will help her ovulate at our own timing. Okay? When we give this injection, we know that in the next 34 hours, this woman will ovulate. So what do? Before that 34 hours, that her husband's sperm that is with us, we'll bring out the sperm from the liquid nitrogen where we froze it, then wash it and inseminate or put it inside the woman straight to the uterus so that the sperm will not swim to meet the eggs once ovulation takes place. With this, pregnancy will be achieved. That is IUI. Have I answered the question, Dr. Chika?
Yeah, you've done a very good job of it. Yeah.
All right.
Okay. So somebody asked if you still feel you need some clarification, can still put question, can put it down there. Now somebody asked a question. Lady started her period at 11. When will she hit her menopause? Because about the question. Okay. She's currently 32 years. Then what is also the risk of Down syndrome for babies at born at 35 years?
Okay. Now, Madam Chief, please. Starting your period at 11 does not mean maybe the woman will get to menopause early. No. Now, this menopause thing, it depends on the number of eggs you came into this life with. We all know at 4 months fetus, every baby girl already has come into the world with the eggs they are supposed to come in. While they are still fetus, they are losing the eggs. Yes. We cannot categorically say she's going to get to menopause early or late, except she goes for an AMH test to check her ovarian result. Now, for 35, most times people don't understand that the risks of Down syndrome comes mainly from the sperm cell. Okay. Now, when the sperm cell is highly fragmented, there is every risk that the baby is going to come out with either chromosomal gain or chromosomal loss. Chromosome 21 may be missing, or it may be an excessive gain. So it might not. It's not always the egg. No, it's not. Please, it's actually the sperm. It's actually the sperm, not the egg. So at 35, you shouldn't beat yourself up that you are going to give birth to a baby with Down syndrome. It's not true. Your egg, it's not the cause of Down syndrome or any abnormality. It's usually the sperm. Have I answered your question?
Okay, thank you so much. See, we used to think that it's the woman. Everybody blames the woman for everything. Huh? So that's, people have heard it now from the experts. Yeah. So reserve your is there any like advantage, like if one preserves his or her sperm cells, that when person is going to get it, is there any way they try to remove the fragmented ones and leave the healthy ones?
Okay, no. Now, the good thing about sperm freezing is most sperm that don't survive freezing are actually sperm that have fragmentation and have a genetic anomaly. So any sperm that survives sperm freezing is actually a good sperm.
Okay, so you see, it even assures you of that at the end of the day, when you need it, it's only the good sperm that you're going to get, right?
Yes.
Because all the bad sperms would have died.
Yes, and they will not survive the sperm freezing at all. It's minus 187 degrees that the sperm is being frozen at.
Okay, that's good. So the next question is, somebody's asking, can you explain the difference between a fertility specialist and a gynecologist?
Okay, gynecologist.
And when should one see each type of a doctor?
Okay, now fertility specialists are most times, okay, now the consultant fertility specialists are gynecologists who have gone through the process of fertility training. They are two different people. He's a consultant gynecologist. He's a consultant gynecologist / fertility specialist. Now, after writing your part 2, you're already a gynecologist. Now, it's now on you to take a next step. You have to be trained, okay, as a fertility specialist, because fertility treatment is not even taught in the medical school. Dr. Chika, you people know that. You don't do all those OCR, how to let the patient know about OCR and all this in the no. Now you have to go for fertility training entirely. We have different centers, different institutes where you can train as a fertility specialist, as a doctor, as an embryologist, and as a nurse. So you choose the area you want to specialize in. If you are a doctor, we have a lot of doctors who want to be embryologists. We have embryologists who want to train as doctors, you understand? But the difference is that the gynecologist is just gynecologist. He's not fully aware of most of the things relating to fertility and fertility treatment. Okay. And who should you see? What do you mean by who should you see? If you are having challenges achieving pregnancy, I think you should see a fertility specialist, not just a gynecologist.
I agree with you too, Moji. Yes, I think fertility specialists will have a better view of how to counsel you properly than just a gynecologist. You know? So that's okay. Now, somebody asked about the list of supplements. So, person will, she's going to post the list of supplements that will help you enhance your fertility on the group later on, as she has promised. Okay. So the next question is, how can Christian couples reconcile reliance on God with the option of fertility preservation when facing medical risk or career-related delays? Okay, did you get that? How can they reconcile?
Like 3 questions.
Yeah. How can Christian couples reconcile reliance on God with the option of fertility preservation when facing a medical risk or a career-related delay?
Okay, now, first, we all know that achieving pregnancy is only God. Do you understand? Because this sperm or egg we are freezing that forms a baby is God. Because you can generate embryos, put them in the best womb, and yet pregnancy will not occur. Now, when couples come into the clinic, you know, this fertility journey is actually very emotional and it takes a toll on everybody. Now, if the husband or the wife, either of them, has preserved their fertility prior to this time, okay, it will be easier for them to say, okay, I have preserved my fertility. Let's use my egg or let's use my sperm. Okay. Now, because of career delay, a woman that is 30, let's say 40 already, because she's chasing how to be the Zenith Bank CEO or director, you know, she was busy in her 20s, 30s, you know, chasing after being the CEO of Zenith Bank, and so because of that, she didn't even pay attention to any man that was coming her way. Now she's 46, and Mr. Right has come. All she needs to do is, sweetheart, I have my eggs frozen at Nisa Premium. Let us go there. Okay. Now, in a case where maybe the tables were turned and maybe the man was chasing a political career, he doesn't want to get married because women are a set of distraction, and so he continued, and now he's 55 already, and he wants to have a child. And God being so faithful, he did not freeze his sperm early. And he's still very busy. Today he's in Lagos, next tomorrow he's in Abuja, next tomorrow he's in Sokoto. All they just need is come to the clinic. We collect the gametes and treat. We can do IUI, we can do IVF. It depends on the age of the couple. Do you understand? I don't know if I've answered that question, because that question looks very complicated.
It is actually a very complicated one. When you talk about Christian faith, and it's all about faith, it's all about the individual, it's all about the relationship with God. You understand? So a lot of things come into play here. So it's difficult to actually coin one answer to this question, you know. But at the end of the day, everything, even the wisdom for fertility preservation came from God, obviously, you know, because it is still helping people to achieve, you know, pregnancy at the end of the day. You know, the goal is pure and good, and the goal falls in line with God's plan. God said we should we should go into the world and dominate, you know, and all that. So it's still in line with God's principles and operatives. So it's the answer. It's complex and complicated. So you've done a good job there. Okay. Okay. So the last question I'm seeing here is saying, are there factors that lead to fragmented sperm cells inside a man's body? If yes, what are they?
Yes. One, lifestyle. Drugs it's one of the major causes of DNA fragmentation in sperm. Now, when you have actually it's Siri that asked that question. Siri is a lab scientist. Now, when you have semen come to you in the lab and you see crystals like oxidant crystals, all these shiny crystals, automatically you suspect that this man is on hard substance. Now, that substance is not just there for decoration. You should know that it should have done a lot of damage. And when you are seeing crystals, you're also seeing epithelial cells. You will notice that the man's body cells are wearing off automatically. Okay? Now, that is one major factor. The second factor is environment. People that stay in the South, they have tendencies of having fragmentation in their sperm DNA. Thirdly, age. Older men have a lot of fragmentation in their sperm. With age, DNA fragmentation in sperm is very high. Okay? Then feeding habits, lifestyle. Lifestyle covers that drugs, smoking, and all those, alcohol, and all those. It covers it. I don't know if I've answered your question, Siri. Somebody has a hand raised up.
Okay, somebody wants to ask a question. So Softy, you can unmute and ask your question.
Good evening. Thank you for the very detailed lecture. So my question was actually the one you skipped on supplements. I wanted to clarify, it's not about supplements for infertility. Someone had already asked that. But I was just saying that in addition to supplements for infertility, it would be nice for the doctors to also drop supplements for women that are 40 plus that can help with hormonal imbalance.
Okay, no problem.
Okay,
we'll
thank you very much. Thank you, Softy. Yeah, she's noted that. Okay. Any other questions? Anybody, any other person want to speak? The floor is open. You can unmute and speak. Any questions? You can unmute and speak.
Nobody wants to speak again.
Okay.
I think it answers a lot of questions, actually.
Oji. Yeah.
Anyway,
Okay.
I have OG, sorry. I got one question to ask.
Please go ahead. Go ahead, please.
Okay, thank you. So assuming somebody wants to sell their eggs or sell their sperm cells, are there locations where these transactions can be done, and how much do they go for?
Hey, Siri, transactions. Okay, please don't allow EFCT arrest us. Now we call them voluntary egg donors. Okay. Now these young ladies, 18 years to 25 years, they come to fertility clinics. What do? They come to donate their eggs. You know, they volunteer as egg donors to give us their eggs. Now, when they give us their eggs, we are using it to treat for older women or even for research purpose. Okay, we use it for treatment for all other women who already has menopause or people with premature ovarian failure to achieve pregnancy. Okay, yes, they have fertility clinics in even my clinic. Yes, we accept egg donors. Egg donors are paid between 150 to 280,000, depending on the hospital. Okay, that is for egg donors. So between 150 to 280,000, it depends on the hospital. Now, yes, for sperm donors, for every ejaculate, you get to pay between 50 to 100,000, depends on the blood group and also the complexion of the donor. Then if it's, there are some donors, there are some special donors we pay even up to 1 million naira, sperm donors. There are some special sperm donors we pay up to 1 million naira. Depends on what we are looking for and you have it, then we can pay you up to 1 million naira. Yes. Next
What are
question.
those things you look? What are those things you look for?
You want to
That's
donate?
good. And also, how does complexion also affect?
Now, Oyibo children, Oyibo, now you get them.
Now you
Okay.
understand.
Okay.
Caucasian sperm and people that are O negative donors, we pay them better than we pay the regular positive donors, because O negative people are very rare. So people like our vice president, Obiora, is O negative. So if I want him to donate his sperm for me, I'm going to be holding very good money to pay him for that.
Chairman, you get pot belly, the sperm no go, now 100,000 pay you.
Chairman, at 20,000, we will give her.
Very quality sperm. No, you see my soil, it be like half cast.
Half cast.
I even tried to talk 100,000. What you say now? 20,000? She never pity you.
No man no deal. Like, why I don't agree call donate spam now? I for not donate for our sake. They pay me small money. Now money, this pay me and they beg me. Like this pay me and they beg me 950. I say me read that 1 million.
Oh, thank you so much, OG. It was a wonderful session. Please, let's give a round of applause to OG. That was a great one. Thank you so much. And thank you so much, everyone, for listening, for coming on board, giving us your support. Yeah, we wish for more participation in our future presentations. Okay, thank you so much. It was a wonderful one, OG. Well done. Well done, everyone. Okay, please, let's take the celebrations to the group. Please, thank you so much. She's done a good job. Thank you so much. So if you have any issues on fertility, if you need any support for fertility, feel free to contact OG. I'm telling you, she's always available at all time. I have people who have directed to her. You know, I tell you, she is good and she works well. She will help you to get it as affordable as possible. Okay, please, reach out to her. I'm telling you, she'll help you to get the service as affordable as possible. Okay.
Thank you.
Thank you. So good night, everyone. Thank you so much. Bye.
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 George, on close.
Andy, you don't close. They say you should breathe.
Randy, please. Off us.
But I don't say me. Like, come on now, they close the whole church, close everywhere, window,
Don't
door.
close. We want to go and sell some things. Close it.
So, OG, you were supposed to be 2 now. Where the other person? I be that one don't go. Be like, OG, don't go.
Don't cover for that person.
Oh, OG, don't go. Oh, yeah, oh, they say thank you for coming. Oh, they're not going to share condom today. Oh, now bye bye. Oh.